and welcome. In this series of films, we're talking to public health experts from across Europe to further understand how we can maintain and improve public health during and after the COVID-19 pandemic. In this film, we're asking what is the impact of the pandemic in Europe in terms of economics and mental illness. Firstly, I'm joined by Professor Martin McKee. Professor, thank you for joining us. We're hearing, of course, about a great impact because of economics, job losses, financial uncertainty now and indeed will go ahead into the future. There's a strong link between financial distress and increased levels of mental illness. Can you tell us more about that correlation?
The first thing that we have to say is that from both the economy and a health perspective, it is crucial to get the pandemic under control, because if we don't, then both will be very badly affected. It's absolutely not a case of either or trade-offs. That said, there is a lot that we can do to mitigate the effects of closures and restrictions. We've learned a lot about that, in particular from the global financial crisis that took place began in 2008. And we were able to see there that different countries responded in different ways. Those that invested in mitigating the effects for their population by avoiding the worst excesses of austerity were the ones that managed to come through from an economic point of view much better, but also with the least effects on health. What we see at a time like this is that people's lives often become very precarious. They find that they have precarity of income, of employment, of housing, and also in some cases of food. And if governments can help to overcome some of these anxieties, then they can have a very important way of protecting their health and in particular their mental health.
Professor McKee, thank you very much indeed. And welcome, Michele Cecchini. The lockdowns implemented across Europe have, of course, helped save lives, but there's been a huge economic cost. If there's going to be a second wave that we must anticipate, what can be done to keep people safe, but also minimise further economic damage?
We need to find the right balance between needs related to public health. We need to avoid a second wave and at the same time reopen countries for business. At the OECD, we have calculated that this can be done by implementing a comprehensive public health package based on 3 pillars. The first one is a massive upscaling of what is called testing, tracking, and tracing. We need to quickly identify and quarantine new cases and avoid that this person spread the infection further. Second pillar of this package is enhancement of hygienic measures and use of masks. Again, we need to avoid that people get contaminated and infected by touching contaminated surfaces, and we need to avoid the further spread of the infection. The third pillar is that we need to keep in place some further policies, containment policies and physical distancing policies. The more we are able to invest on the first 2 pillars, tracking and tracing and enhance hygiene, the more we can open the economy.
Thank you so much for your insights. Thank you for joining us. And now joining us is Professor Jutta Lindert. Professor Lindert, it's of course not just governments that have a role to play in this. What's your view of the need for collaboration at a European and indeed an international level in order to bring together the scientists, the policymakers and the practitioners who can help mitigate the mental health damage from all of this?
At the scientific level, we need more studies to really understand the impact the pandemic had on the citizens and still has, and to be better prepared for eventually future waves and future pandemics. Likewise, for practitioners, it is necessary to communicate in a good way and to learn from each other so that practitioners can develop interventions as soon as possible to help the population cope with the stress of the pandemic and to help policymakers to include public mental health responses to the pandemic and to preparedness plans.
Professor Lindert, thank you very much for your insights and for joining us. And thank you for watching. Goodbye.